Hello and welcome to Unstress. I'm Dr Ron Ehrlich. Now, when you decide to have a family, when you have kids, it can get a little stressful. And I remember when my wife was pregnant with our first daughter, we were so preoccupied with the pregnancy. And to be honest, there weren't all that many of our friends around us with kids. So we kind of thought, okay, once we have the child, life can just get back to normal. Okay. Yeah, that was a good one. Incidentally, at the same time, a paediatrician gave us one amazing piece of advice. In the first year of life, teach your child to sleep, she said. That means routine. Get a good routine going. Well, yes, we ignored that and felt our child would just fit in with our lifestyle. And in retrospect, that piece of advice was the best piece of advice any health practitioner could give anyone of any age. And if you haven't been listening, if you have been listening to this podcast, you'll know that sleep's is a recurring theme with good reason. And now my guest today is Annalies Corse. And Annalies is a medical scientist, a senior lecturer in anatomy, biochemistry and physiology, and she's also a naturopath. So while we know pregnancy takes 40 weeks and is roughly divided up into 3 trimesters of about 13 weeks each, it's actually, and in retrospect, obviously, when the baby is born, that the fun really starts. Today we're going to discuss the 4th trimester, and I'll leave you to work out how long that 4th trimester goes on for. Now, there are many challenges, both individually and as a family, and that's when things just proceed along relatively normally, and that doesn't always happen. I think this is a very interesting conversation. I hope you enjoy this conversation I had with Annalies Corse. Welcome to the show, Annalies.
Hi, Ron. Thank you so much for having me today.
It's a pleasure. I've been looking forward to our chat. Now, listen, having a baby, we know, takes 40 weeks, or that gets divided up into 3 trimesters. But once the baby is born, and particularly the first baby, life doesn't really get back to normal, does it? I remember when we had our first child, we thought, look, once we get over this pregnancy, life can get back to normal. How silly were we?
Exactly, yes.
We're on a very steep learning curve. And you've coined this phrase, the 4th trimester, which I loved. I love this idea. Tell our listener what the 4th trimester is. How do we define it?
Look, it's probably, to just backtrack slightly, it's probably not I can't take the credit for the term because it is a term that's out there that you do hear about, but it's definitely not a mainstream term. But it's definitely a term that encompasses that time in the family's life. Often it's just applied to the woman, but the way I view it is it's the time in the family's life, the new family or the current growing family, after the birth of a new child. And it may be the first child for the family, or it could be the 2nd, 3rd or 6th child, because me myself, I only have 1 child, but I'm assuming that if I have more, it's going to change again, and then it probably changes again after more babies come along. So it's that time that very much focuses on the woman because she's going through so many metabolic, physiological and biochemical changes because she's given birth. But there's a whole lot of psychological, emotional and mental changes that involve everyone in that family unit. So for me, the 4th trimester it's a trimester for the woman, but it's also a trimester for the family.
And I mean, you mentioned those biochemical, hormonal, emotional changes. I mean, the baby is delivered and so much happens, doesn't it? I mean, obviously you've got this new child, but hormonally, biochemically, just run our listeners through some of those challenges.
Yeah, sure. Look, obviously the first challenge is there's a lot of changes that go on with certain systems like the circulatory system. In those first few days, there's a lot of changes occurring with fluid balance and sodium balance, and also the lymphatic system and the cardiovascular system. You know, things like blood pressure might be returning to normal because they were aberrant or abnormal or high during the birth phase. So in the first few days, the cardiovascular system goes through a lot of changes. The endocrine system goes through a lot of changes in that acute phase when certain hormones start to return to normal. So because you not only do you deliver a baby, but you also deliver a placenta. So the placenta is now gone and you're missing out on the progesterone that would have been there to maintain your pregnancy, and there are other hormones involved as well. The placenta is an absolute biochemical factory of different hormones, so there's a little bit less like insulin-like growth factor. There's quite a number of different hormones that change in that acute phase in those first few days after birth.
It's often prized, isn't it, in many cultures, and I know some people have taken that on board quite literally, prizing this placenta and preserving it.
Yes.
Some even, have I heard this correctly? Some even eat or,
Yes.
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 And culturally.
Certain cultures consume it because it is a bit of a nutritional powerhouse. I mean, for us in the West, we probably look at it with a little bit of horror and gore, to be frank.
Mm-hmm.
But in other cultures, I mean, it's just another organ and it's a life support system. From a nutritional perspective, it's probably a lot like liver in terms of its nutritional profile.
Okay, well, that is always been considered a kind of superfood, isn't it?
Yes, absolutely.
Yeah, so biochemically, well, it's just so huge. I mean, watching the whole process, you still can't, it doesn't matter how many times you've seen it or, know, it's been involved in the family. It's such an incredible process.
It is, absolutely. And then the changes can be not just what's going on in that week afterwards, but even months afterwards, those long-term hormone shifts that occur with the thyroid hormone axis, and then you've got all the changes that are occurring with your sleep patterns and mental and emotional health that can all change your physical health as well.
Yeah. And of course, one of the very first things that happens is breastfeeding kicks in, and it's not always. What are some of the challenges? I mean, what are people, it's held up as the gold standard and for good reason, but what are some of the challenges that women experience in this, as breastfeeding starts?
Yeah, sure. Look, I think for a lot of, especially first-time mothers, you just sort of expect that once the baby is born, you might be, depending on how you delivered, you might be in the delivery suite or you may be in recovery if you've had a C-section, but that baby is put to your breast and you sort of expect it to just happen naturally. And for most women, it doesn't, especially if you're a first-time mother. Your colostrum could, even just colostrum, the secretions before the milk, that can take several days before the colostrum comes in. It's not this instantaneous response that occurs. And some babies need to learn how to breastfeed. They're born not knowing. It's very instinctual, but they're born not having, say, the best attachment and the best sucking reflex. And so it takes a lot of time and it takes a lot of effort. It's not always this relaxing, let's just kick back and breastfeed type of situation that we tend to see in a lot of mainstream representation of breastfeeding. It can be very difficult. And I think for a lot of women, they may be encouraged a little bit too early to adopt an alternative. I mean, that's my personal and professional opinion.
Yeah.
But there are a lot of difficulties that we can run into. And it's a very unique decision, obviously, but I think it's something that needs more attention.
Yeah. So when you have the baby, the colostrum supposedly comes in for the first couple of days. If it doesn't, does that mean nothing comes in?
No, it usually just means that either hormonally the changes haven't really taken place yet. So the oxytocin might be taking a few days longer to come in, which is actually going to help kickstart that letdown reflex in the breast. So there could actually be a lot of colostrum present in the breast tissue, but also that it's very much an axis that involves, the hypothalamus and the pituitary gland, and then that's where the oxytocin is produced. So the messages that are coming in, the input that our brain is receiving, those input signals may not be particularly strong. So I guess the lactogenesis that follows the production of the breast milk that follows the colostrum, there's a lot of input that has to happen in that time. So if mum is stressed or she doesn't have adequate time to just sit with the baby and have it on the breast and just allow the fact that just the sucking and having the contact with the baby, things will start to happen if she is given the time and the space for that situation to be nurtured and develop. So the colostrum, even the colostrum can take a couple of days. And it's a very physical response. You really have to be, and it's not gentle, you really have to be squeezing on the breast. And in some cases, if the colostrum hasn't come through, if the lady delivers in hospital, she'll often have the midwives squeezing on her breast tissue several times a day, and she'll feel, for want of a better term, she'll feel like a dairy cow, because you really have to pump and press and push to get things going.
I mean, culturally over the millennia, by the time you got to having a baby, you would have seen so many of your tribe or village breastfeeding and gone through this whole thing. So it's really kind of been thrown in the deep end, isn't it? You haven't been primed for it. You haven't been mentored through it. And here you are suddenly faced with it.
Absolutely. You've gone from, say, high school to straight into work or straight to university, into a 9-to-5 job, having social life, travel, working. A lot of women work up to a month before their delivery date, a week before their delivery date, and then all of a sudden they're in hospital and now you have to breastfeed a baby. Modern women in sort of, I guess, more affluent society, we don't have those connections that tribally we would have had, or even what exists still in today's world, but in other, I guess, demographics or other societies.
Yeah. How do you mentioned stress and, the hypothalamus pituitary axis is a pretty important part of the stress response. So obviously being more calm, but how would one prepare to optimally breastfeed? Is that, can we do things to prepare for it?
Yes, look, there is, and I think it does start during your pregnancy. I'm a big fan of keeping things simple, but in keeping things simple, you also have to look after yourself properly. And the actual lead up to breastfeeding starts when you are pregnant. And a lot of women will notice things like the proliferation and the growth of her breast tissue. And that is the start of breastfeeding, because it's known as mammogenesis. So you get the growth of the breast tissue, and that's under the influence of estrogen and progesterone, which is mainly coming from the placenta, but it's also her own estrogen and progesterone that she would be producing. But then later on in the pregnancy, you have the development of the actual milk. So that's starting to be synthesized and it's starting to be stored in the breast tissue. And it's the big withdrawal of the progesterone and estrogen at birth that allows the lactogenesis to really kick in. So the delivery can have a lot to do with it, the type of delivery that she has, whether it was stressful, whether it was calm, whether it was traumatic, whether she was anaesthetized for the birth or not anaesthetized for the birth. And then in those days and weeks afterwards, how much, I guess, like you say, what's her environment like? What are her stress levels like? And that can have a huge influence on how much oxytocin she's producing, so that, again, that HPA axis kicks in. And oxytocin is that hormone that we associate with bonding and love. And there's a lot of other things that oxytocin does, but that's probably, in a nutshell, that's the hormone that really, really brings the letdown reflex of actually helping the milk be ejected from the breast tissue to actually take place. And then there's a fourth thing known as, I think it's called galactopoiesis, this big funny name for maintaining your lactation long term.
Right.
And really that's just got to do with how long do you want to breastfeed for, because if it's set up and it's working and the baby's still going to your breast, you can pretty much breastfeed indefinitely if your underlying health is robust.
I know culturally that is where there is a great deal of variety, isn't there, in terms of how long people breastfeed for, because I know we were in Italy several years ago and a friend of ours whose 5-year-old daughter came in and literally unbuttoned her shirt and started feeding on her. It was quite confronting for us, but culturally it was perfectly normal. But going back to the birth, the incidence of caesarean birth is something that has become, well, I'll say more popular, but more common. Are you aware of the statistics?
Oh, I think I read something about 2 weeks ago that in Australia it was something like 1/3 up to approaching about not quite 2/3.
Wow.
So I think roughly at the moment, when you look at the last stats that were officially taken about 12 months ago, it was about 1/3. I don't have actual stats on whether those are emergency or elective, but even the incidence of elective caesareans are definitely increasing.
That's a
Yes.
very, very high figure. I mean, partially, I guess, explained by people having babies later.
I think that's got a lot to do with it. I mean, if you look, it doesn't take a lot of research to just, if you think about your peer group or your friend group, if you think about the age that most people have their children these days, more and more into their 30s, late 30s, early 40s, some even beyond. We also have the option of assisted fertility. So obviously you can be a little older and have children as well. And that's all wonderful that you can, say, have a career and then delay having your babies. But going with that is health. And for a lot of women, you really need to think carefully, men too, but women are the ones who are going to be delivering and carrying the babies. So you do have to think about your underlying health. And as a byproduct of getting older, there are certain things that crop up. So things like metabolic syndrome, insulin resistance, hypertension. You've also got the fact that you've been older for a little longer. And if you've had, say, bad habits in the past and you've been carrying those bad habits with you right up until the time that you've now decided to start a family, you may have been smoking for a lot longer. You may have been, I don't know, dabbling in recreational drugs. You may have been, say, drinking socially to a high level for a lot longer. And all of these things, while they can seem benign because they're a social thing to do, they can have an impact on our health. And particularly when you put the body under the added stress of carrying a pregnancy and giving birth, it can lead to complications which may lead to a decision of, let's give you a caesarean.
Yeah. And there must be some challenges there for the difference between, the vaginal birth and I mean, the C-section is an operation. It's an abdominal, incision. And so that creates a whole range of other issues, not just for the mother, but for the child as well, isn't it?
Yes, absolutely. And it's really interesting because in the last couple of years, I remember about, say, 5 years ago, there was a lot of research coming out to say that children born via caesarean section weren't receiving the microbiome of the mother and they were being inoculated by the bugs of the hospital, etc. Now, when you look at some research that's much more recent, say in the last 2 years, there's research to say that no, babies are not sterile. They're inoculated and exposed to microbes via the amniotic fluid, and it's not that sterile, I guess, trap that we once thought it was. So babies are being exposed to the maternal microbiome in utero. So C-section babies are not as sterile or as compromised as we originally first thought. But again, that's, I guess, not a free pass to say, hey, caesareans are all okay, because absolutely they're not. And whilst a caesarean might actually reduce stress for the mother if she's elected to have a caesarean because she's having twins, for example, she might be awake for that procedure. She might be very happy with her decision to have a caesarean. The health of the babies is, I guess, optimised through having a caesarean in that situation. But then whilst she might be emotionally and mentally very happy with that situation, physically she has had an abdominopelvic surgery, and that's a physical stress on the body. Stress is, as you would obviously know, an expert in it, it's not always mental and emotional. We have physical stress, and surgery is a physical stress.
Yeah. And would you recommend, though, even given the finding that amniotic fluid contains microbes, would you be recommending to these 1/3 or 2/3, up to 2/3 of women having caesarean, that probiotics postpartum is the way, you'd encourage your baby to have, your infant to have some probiotics?
Yes, absolutely. And it's one of those things that the probiotic can come from, say, a supplemental form, and you can obviously get probiotics that are formulated to contain the strains that are needed for the infant. So they're made specifically for newborns. You can even get strains now or supplements that are specific for preterm babies as well. But that's definitely a recommendation, and it can be something as simple as, if you are breastfeeding, to buy it in, say, a powdered form and apply it to the skin around your breast tissue so that when the baby's feeding, they're getting the exposure that way. But we get inoculated with bacteria through so many different means, and even just having skin-to-skin contact with you as the mum, or with your partner, the father, or another mother partner, whatever it is, because that skin-to-skin contact is very important, and those skin microbes are one way of actually helping with exposure and inoculation. And then after the baby is sort of not in that very, very precious newborn phase, as they start to get older, they start to explore the world. They're getting into the dirt, they might be exploring plants and plant life, and possibly even family pets. And that is a huge and very important way of actually getting into contact with microbes. And you and all your listeners would probably know about, the hygiene theory when it comes to allergies and autoimmune disease. And we tend to like our environments really pretty and clean and pristine, but it's not always the best thing for our health.
Yes, it's almost like as we become more preoccupied with killing as many bacteria as we can, we become sicker in the process.
Yeah, that's right. Yeah, so exposure is very important. And in those early days when the babies are little and fragile and precious, and you're a bit too scared to expose them to too much, then a powdered supplement either on the breast tissue, or maybe if the baby is bottle fed, on the teat of the bottle, is very beneficial.
And now back to the fourth trimester, because the baby's born, the abdominal surgery or the vaginal delivery we've recovered, but of course we're now faced with a whole new life, literally. For everybody involved, not just the whole new life you're holding. What are some of the challenges? I mean, they're obvious, the social challenges, but from a health perspective, how do we support the fourth trimester?
Yeah, look, I think it's a case of looking at sitting down as, with your significant other or your family, if there's not a significant other present, and just seeing what are the biggest things that have changed, because everyone's fourth trimester is very, very different. And look, to be honest, I hardly spoke about this with clients before I had a child of my own, because I didn't have the insider knowledge. And now I talk about it with them all the time. And I usually say to them, look, let's have a talk about what are the biggest things for you that have changed, whether that's a physical thing or an emotional thing. And what are the priorities for you as an individual, as a couple, as a family, that you think, A, need to get back on track, that you've sort of lost your way somewhere? Is it your diet? Is it your relationship? Is it your sleep? Is it your sense of freedom? Are you not getting enough of a break? Work out what the priorities are for that particular person and their family. And I guess from a naturopathic and holistic medical perspective, we tend to focus on all the things. We don't just focus on the health. So prioritising where the changes need to be made or where the improvements need to be made, and just because it's a very overwhelming time, and often you're time poor, you're devoid of energy, you're not sleeping well. And so rather than making it too overwhelming and saying, well, these are all the things you need to change to make yourself feel better, just pick those 1 or 2 or 3 things that you can safely and think you can get a handle on, focus on those, and then move on to the next thing or the next thing. And there may only be 1 or 2 things that a family says, look, these are the things we need to work on.
And in your experience, what are the most challenging things in this fourth trimester for the clients that you've seen, for your patients?
I think there's 3 that are very common, that I sort of find are common to about 80 to 90% of the people I see. And the first one is sleep, which is very obvious. Living life with sleep deprivation makes everything pretty hard and pretty terrible. You usually don't have enough energy to prepare healthy meals. So there's that flow-on effect, lack of sleep, not looking after myself, not eating properly, and then there's that whole flow-on effect of not eating properly. So for me, sleep is always a big one for the couple or the individual or the family. So working on finding out because everyone is so focused on getting the baby to sleep through the night. That seems to be the thing. My baby's not sleeping through the night yet. When will my baby sleep through the night yet? They probably won't for a long time, and It's the acceptance of that and working out strategies to cope through those months or up to the first 12 months where that's not happening. So there's lots of strategies around sleep that we need to focus on. But the other two things that tend to pop up for a lot of people is changes in the relationship if they are in a marriage or a partnership. There's huge changes, and I find I don't hear this so much from the men, but I hear it a lot from the women. They grieve the relationship that they had with their partner before the baby came along, because now they have less time for each other.
Yeah.
And the relationship changes, and they sort of talk about it as feeling a bit like a grief process, because it's not that the person's not there anymore, they're there, but they're sort of grieving the loss of what they once had, and that can take, for some relationships, it can take a toll on the relationship. And so that's a big one that I see a lot of women, so I mainly hear that from women, but I'm sure if I spoke to some men, I would hear that as well.
I'm sure you would, yeah. Yeah, I'm sure.
I think, and the third one tends to just be nutrition. They just don't have the time, the energy again to look after themselves in the way that they used to before they came along, particularly if it's a first pregnancy and they did all the things right in that pregnancy to look after themselves, to eat well and exercise, and now it's just not happening. So they're the big three that I tend to think. I find most people struggle with those three anyway.
Yeah. Well, it's a recurring theme on this podcast, the importance of sleep. And, to anybody who's just had a baby, they know very well what sleep deprivation can do to you. What do you say to people, as you're advising them about this aspect of having a newborn, about sleep?
Well, I think it's a case of sleep is now a priority for you. Maybe in life before baby it wasn't, because you could just go to sleep at 10 o'clock and wake up at 6 and nothing would interfere with your sleep. But now you've got a little baby that's going to interfere with your sleep. So there's always a lot of questions around, feeding. When is the feeding? Are you demand feeding overnight, or are you doing timed feeding? Sometimes there may be some adjustments that need to be made. For me personally and professionally, I'm a big fan of demand feeding. I know that a lot of people will be scrunching up their face going, oh my God, that's too hard. But I know that if a baby is, say, crying and staying up all night for many hours, and then if the mum finally relents and gives them a feed, often they'll go back to sleep, and they may have just been hungry. I think about us as adults, usually we eat when we're hungry most of the time. And with babies, some babies do very well on a schedule, others don't. And so maybe try demand feeding for a little while, because often you might only be up for 10 minutes, giving them a little feed and a bit of comfort, and then you can go back to bed, as opposed to listening to a baby crying for 2 hours, waiting for it to be 2 a.m. so that you can feed them.
Mm-hmm.
So I tend to look at what's going on overnight with the feeding schedule and how much is that impacting on the parent's sleep.
Yeah.
So that's the first thing. There's that old saying, sleep when the baby sleeps. So I guess I do talk about that and what's going on during the day, and find out, do you want to sleep when the baby sleeps? Some people wake up groggy after a day's sleep and it just doesn't suit them. But power naps, I'm sure you would agree, are quite important. If you can't sleep, just a lie down with your eyes shut can be restful. Maybe if you don't want to sleep, it's just sort of looking at where can you just physically get some rest, just take the weight off your feet and rest, do something or anything that's restful. So, what's going on in the day, what's going on in the night, and also having someone to take the burden off that nighttime feeding occasionally can be a big thing, whether it's the partner or I don't know. Usually it falls to the partner, the husband or the other partner to help out. And if that can happen, I think that that's so important. We're so lucky to live in the era these days of, it's very much a partnership with the parenting, and so many dads are wanting to get up to do a feed overnight if they can. I think that's important.
Given we are no longer in that village, that relationship has never been more important, arguably.
Absolutely. I couldn't agree with you more.
Yeah. And look, as a father, I think one of the most, I mean, I never got up to breastfeed. I sadly couldn't do that, but being involved was something that I think is one of the great experiences in life and something I've never regretted. Back to breastfeeding, because I know one of the problems with breastfeeding and that people sometimes miss is that the baby may have tongue tie and literally may not be able to suck properly. But if there is a problem with milk, and you've mentioned stress as a big factor, what other factors can influence a woman's ability to produce adequate milk?
Well, definitely her nutritional status. In order to establish lactation, and in order to continue that lactation, her nutritional status is it's one of the most significant things. So it's not just a matter of, sort of what she's eating, but it's micronutrient profiles and all of these sort of factors. So things like magnesium and cholesterol and vitamin A, they're just a few, but there's a lot of micronutrients that are very important for helping to make milk and also to keep that supply going.
Now, Annalies, you dropped a word in there, cholesterol, which you are actually saying, and I think most of my listeners would be aware of this too, but that's obviously really important, isn't it? An important nutrient.
Yes, and it's one of the most maligned nutrients in history, and we make our own cholesterol because it's so important. And I mean, I don't know what level your listeners would have studied this, but
very high, Annalies, very high, very educated.
They're all biochemists.
Oh, pretty well, Yeah.
So they would know that cholesterol is the precursor for all our steroid hormones. So
I know that.
We're talking about a woman's body here, but it's the precursor for things like cortisol and estrogen and progesterone and vitamin D. Vitamin D is a hormone. It's yes, it's a nutrient, but it's a hormone that our body makes. And all of these start with cholesterol. So yes, we're making it ourselves in our liver, but we're also getting it from our diet. And it's so, so important for the content and the nutritional content of breast milk because it's so important for the baby to receive it. But also it's helping to keep the levels of hormones high so that we can continue that breastfeeding. So cholesterol is a big, big nutrient for breastfeeding.
Interesting. Wonder whether during this 30 or 40 year period of the low fat dogma, whether breastfeeding rates went up or down. I suspect they went down during that time, but for many reasons, not just because we were on low fat. But anyway, it's good to, it's interesting to hear you say that. Yes, so vitamin D, cholesterol, good nutrition.
Yes, magnesium is very important.
Yep.
Vitamin A is very important. That's another one that we tend to hear. It's much maligned during pregnancy. Don't take too much vitamin A because it's teratogenic. It causes birth defects, but it's very, very important in breastfeeding and the continuation of breastfeeding. And just fat, good quality fat, good quality protein. I get so upset when I look at, say, celebrity stories or anything targeted at women after they've just had a baby about losing baby fat and losing your pregnancy body and fitting into bikinis after 6 weeks. It's really, really wrong. It makes me quite angry.
Magnesium's an interesting one too, isn't it? Because, I mean, apart from the fact that in Australia, at least, our soils are very deficient in magnesium, selenium and zinc, we get preoccupied with we need calcium supplements, particularly as we're preparing for baby. And the dairy industry love pushing that idea. But too much calcium actually depletes the magnesium, doesn't it?
Yes, it does, absolutely. And calcium and magnesium are important in tandem for so many different things. With bone health, we need magnesium just as much as we need calcium. And, for our muscles, we need magnesium and calcium working together. But absolutely too much calcium is, it erodes our magnesium stores. And particularly with lactation, the receptor for the little sort of lock and key mechanism that allows oxytocin to do its job in the breast tissue requires magnesium. So the oxytocin can be produced in the pituitary gland, But then when it sort of it goes in the bloodstream and lands on the breast tissue, that receptor that allows the oxytocin to do its job and have that letdown of milk, it actually needs magnesium. You know, we could get very nitty-gritty and very much into the micronutrients.
Yeah, let's not. But that's a good one. That's a good one to think. Yeah. Look, we've covered so much here, and I love your 3 challenges because actually, you know, if we're asking when does the 4th trimester finish, I've got a feeling it may never finish, actually.
No.
Sleep, you know, you've identified 3 challenges for the 4th trimester. Sleep, changes in relationship and nutrition. Well, that sounds like life to me. But
It is. And it just becomes, I think it's so much harder when you have kids because they're your priority. You know, I've got a 3-year-old son and I'm constantly running around thinking, has he had enough water to drink? When did he last eat? Has he been to the toilet? Yeah. Blah, 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 as we all do. But you don't think about it for yourself anymore.
Yeah, well, I'm still worried about that with my 2 daughters and they're 31 and 28, but never mind. I digress for a moment. Listen, before we go, I wanted to ask you one question. What do you think taking a step back from your role in all of this birth and pregnancy and trimesters, what do you think the biggest challenge is for people in their health journey through life in our modern world today? What do you think some of those biggest challenges are?
I guess for me, if I was to think about it as a layman not having the knowledge that I have, I'd be really confused who to listen to in this day and age. I really, really would, because with the advent of social media, everyone has a voice and it can be hard to distinguish facts from fiction, and it can be hard to distinguish who's an expert and who's not an expert. Some people who have wonderful clinical expertise may not be able to share it in a way that the average person can understand, and that's where I guess laymen who have an interest and have a voice can be good, but then they may not necessarily have the expertise. So for me, it's who do I listen to? Because there are so many voices in the mix now. I think back to when I was a child. I was a kid in the 80s, and I think about who the authorities were, and you had to basically watch the news and there'd be Rosemary Stanton, or there'd be a couple of nutritionists and a couple of doctors on the TV, and they were always the experts, whereas now there are experts everywhere and there's so much conflicting information and so many fads. So for me, I think that's one of the biggest challenges in today's era of information overload. Yeah.
Annalies, thank you so much for joining us. We're going to have links to your webpage and it's just been great talking to you. Thank you so much.
Thank you. I really appreciate the opportunity. Thank you.
As Annalies was talking, I realised that the 4th trimester goes on for some time, certainly a lot longer than the first 3 trimesters. Notice how the theme of sleep and nutrition keep popping up, doesn't matter what we are talking about. And she was talking, I wanted to remind you about an episode we did with Dr. Chris Winter. We called it The Sleep Whisperer, and I thought his comments on the importance of rest, even if you don't sleep, rest is really, really important. It was really helpful, and it's not to be underestimated. And of course, the importance of communicating as a couple, in fact, not just as a couple, communicating in general, but in this case, redefining relationships as the family grows and changes is also an ongoing consideration. Look, I know that was always an important lesson for me. I think like many men, we love to solve problems. We love to solve problems and move on. Problem solved, no need to discuss any further. Well, gentlemen, not so. It's definitely an ongoing conversation. Now, my daughters are in their late 20s and early 30s, and my wife and I, well, I don't know, are we still in our 4th trimester? I'm not sure. But anyway, the issues that Annalies discussed are as relevant to us now as they were then when we had our child. With that in mind, I hope you enjoyed this episode, and until next time, this is Dr. Ron Ehrlich. Be well. This podcast provides general information and discussion about medicine, health and related subjects. The content is not intended and should not be construed as medical advice or as a substitute for care by a qualified medical practitioner. If you or any other person has a medical concern, he or she should consult with an appropriately qualified medical practitioner. Guests who speak in this podcast